There's a curious paradox about adolescence. For young people themselves, it is the most intense time of their lives when everything seems to be up for grabs and happening. For people who are concerned with health and health inequalities, they somehow forget adolescence. They focus on maternal and child health. They focus on early child development, what happens in the first 5 years of life. Yeah, education's important, but then having said education's important, they move on to adult life and older life. And what happens in between? So we've got this intense time of importance to young people that tends to get ignored, which is terrible. I think of adolescence as such a crucial time because it's a reflection both of causes and consequences. The causes come before maternal and child health, early childhood, have a big impact on what happens during adolescence. And what happens during adolescence is a cause of what comes subsequently. So it's a consequence of earlier influences and it's a cause of subsequent influences. And it's important in and of itself. Think about school performance. In Britain, we show this dramatic social gradient in performance at GCSEs, the national exam young people do at age 15 and 16. The more deprived the area, the worse the school performance. Think about mental illness. Again, we see it. Well-being. Not only do we see the gradient, in the UK, according to UNICEF's report card, out of 36 rich countries, the UK ranks 27th on childhood well-being. The US ranks 36th out of 38, one being the best. Childhood well-being, which includes the adolescent period, is appalling. Are we paying enough attention to it? I've drawn attention to the rise in violent crime among adolescents. It follows the social gradient. It went down for a bit and then went up. Is that related to the cuts in services for adolescents? What about young people not in employment, education, or training? NEET. Now, that tends to be 18 to 24-year-olds, but it's a consequence of what happens in adolescence. All of this is of vital importance. All of it tends to show social gradients. The more deprived, the greater the problems. And it's been too little studied. It's an area of vital importance. If we want to look at inequalities in health through the life course, we need to start with preconception, conception, pregnancy, birth, early childhood, and then this other crucial development period of adolescence, because it sets the stage for what happens subsequently. So to repeat, inequalities in various important outcomes, including health in adolescence, are of vital importance. But so is adolescence important for understanding what came before and what comes after. So looking at mental health at this time of life is vital. Looking at it in the context of inequalities has the potential to make a major contribution to improving health equity.